So, come to the cardiovascular system. Now, cardiovascular system is a combination of cardia, that is heart, and vasculars, that is blood vessels. So, it is one of the heart, which is you can call it simple as a pump, which gives or energize or gives kinetic force to the blood, so that blood can flow through the blood vessels. So, actually, though it is we call cardiovascular system, but we cannot remove blood also from the cardiovascular system, because without blood, cardiovascular system is not is useless. So in cardiovascular system, we'll more talk about heart and blood, and hematology will blood vessels, and hematology will talk about the blood. But these all three components work together. Heart pumps the blood into the arteries and receives the blood from the veins. So arteries and veins are the part of blood vessels, including capillaries. So heart is the one part of the cardiovascular system, then arteries, then capillaries, then come to the veins. So this totally will form complete um, cardiovascular system. So major function of this or important part of this, the cardiovascular system energize or produce a driving force to the blood flow, and blood will keep on moving because of the heart into the blood vessels. In blood vessels, there are two types of the blood vessels: artery and veins. Okay, arteries which receives the blood from the heart, and they receive the blood from the heart with where heart will pump it with force, so they'll receive the blood with a very high pressure, and because of that high pressure, they need to sustain with that high pressure. And that's why arteries are much thick in nature. They are much thicker as compared to veins. While they contain smooth muscle, also large number of thick layer of the smooth muscles in the artery, so that they contract and relax. And by contracting and relaxing, they can change their diameter, and that will increase or decrease the blood flow resistance to the blood flow. So जब भी diameter बढ़ेगा, that there will decrease in the resistance to the blood flow. When a diameter decrease, there will increase in the blood flow. And then major part of this resistance is provided by the smallest type of arteriole, just before the capillaries, and those are called arterioles. The smallest arteries, and they provide the maximum resistance. So even small change in the diameter of these arterioles will provide maximum resistance. That's why I mentioned here about the arterioles. Then once the arterioles over, then it goes into the much thinner blood vessels, which has a various big fenestrations and multiple branched network-like structure will form in the tissues, and they can easily communicate in the with the interstitial fluids, and these are called capillaries. So capillaries which coming from the arterial end are called arterial capillaries. The structure is same, and those going toward the venous side are called venular capillaries. And these capillaries are the part of the cardiovascular system where actually uh, exchange of the substances occur, like exchange of the oxygen, exchange of the carbon dioxide, exchange of the nutrients like glucose, fatty acids, amino acids, minerals, then exchange of the various electrolytes. All those will occur at the level of the capillaries. It is not through the artery or it is not through the veins, but it is occurring through the capillaries. Then they all capillaries come together and will form a small vein that is called venules. And the veins has a very low blood pressure. There's very less pressure because they are receiver in the age, and you know the law. So blood will move, or anything, water or anything will move from high pressure to low pressure. That's why the arterial end will have a high pressure, while venous end will have very low pressure. That's why venous end will resume. Because of that, veins are very thin, and lumen is also very big, so that they can receive more blood. And then this vein, multiple veins will join together forms big veins, and many veins. There's such a dilated portion, and blood is so much stagnant. They also act as a reservoir for the blood, like vessels in the calf muscles, blood veins present in the calf muscles, then veins present in the um, GI circulation, also called as splanchnic circulation. These are dilated veins, and they will store the blood, and this blood will be very stagnantly they are flowing in the circulation. So it acts as a reservoir, and whenever you will need more blood volume, that time we can take a blood from this reservoir by increasing the vasoconstriction. Like when you want to do exercise, or when you are actually doing exercise, that time, or when there is sudden blood loss, that time we'll start removing the blood from this reservoir. So these also act as a reservoir, and they provide extra blood to the heart and prevent also extra overload of the heart because of storage of the uh, blood. Then come to the actual functions of cardiovascular system. So first there is a primary functions, then secondary function. Primary function is distribution of the oxygen from lungs to the cell, and collection of the other waste product and carbon dioxide from the each and every cells, and send it to the respective excretory organ. Like carbon dioxide goes to the lungs, while other metabolic waste goes to the liver or kidney. So these are the main important function of the cardiovascular system. Apart from this, cardiovascular system is also participate in the other functions like thermoregulation. So temperature regulation is very much occur through the redistribution of the blood, because blood is the one which carries the temperature. So core of the body has a high temperature, that is 37 degree or 37.7 degree. While if you see the surface of the body, that is skin, will have a little bit lower temperature. If you are in a biscuit, there will be a much lower pressure. So blood which moves from the core to the surface of the body, they will carry the hot blood and goes to the surface of the body, where they usually exchange the heat with the cool surface, and they will get cooled down. And the cold blood will from surface will goes to the core. This is how will continuously heat exchange will be going on. So whenever we'll need a more, we want to conserve more heat. Suppose now here in Bishkek there is the temperature is very low. So that time if we want to cover the, we don't want our body should lose more heat, then it will cause severe vasoconstriction of the skin, and blood supply can decrease as less as 10% of actual blood supply of the skin. That is enough for the survival of the skin. And now there is a blood is not going on the surface, so there will be no exchange of the heat occurring on the surface. So this is a function of cardiovascular part. Similarly, now suppose there is a temperature high in the environment, like suppose there is 30 or 40 degree temperature, then there is not much exchange of the heat occurring at the skin level. There hardly we are exchanging. So body temperature might be start increasing. So to prevent that, sorry, to prevent that increase in body temperature, there will increase blood supply to the skin. They will be causing vasodilation. We call it flushing, and more blood will go to the skin, and it will exchange the heat with the external environment, and we start losing body heat, and we will try to maintain our body temperature. This is how the cardiovascular system plays role in temperature regulation. The distribution of the hormone are the product of endocrine gland, and endocrine gland always secrete their products directly into blood. So hormone is distributed through the blood flow, and blood is flowing through the cardiovascular system. Then similarly, delivery of the various blood cells, antibodies, and other defense mechanism, cardiovascular system plays important role. But these all are associated with some other system. But these two are exclusively function of cardiovascular system. Now, to understand how the heart functions, we must understand briefly about the anatomy of the heart. I guess you already know the um, These all, but I will just want to refresh your mind about this. If normal adult human heart is somewhere around 30 gram, and it made up of four chambers, and these four chambers is divided into two half, right half and left half. Each half has two chambers, one atria, one ventricle. So the thin portion, thin wall atria, which receives the blood from the venous side, is called atria, while a thick wall which receives the blood from the atria and pump the blood into artery, that part is called ventricle, which has a thick wall because they has to generate more pressure. So first we see about the atria. The atria are divided into right and left atria through the interarterial septum, and this is one of the side where we can have a septal defect. So their atria is like this in intrauterine life, it's open, then just after birth they will get closed, and sometimes the closure doesn't occur properly, and that time it can cause arterioventricular septal atrial septal defect. Then come to the structure of the right atrium. Right atrium is the receives the blood from the rest of the whole body. The entire body it will receive the blood, and that is it receives deoxygenated blood. So what oxygen present in the blood will utilized by the tissues, and then with a very low oxygen concentration, it is not like there is no oxygen in that blood, but the oxygen content is very low, and that low oxygen content, we call it deoxygenated blood, will come to the right atrium through inferior vena cava and superior vena cava. These are the one of largest veins, and which receives like superior vena cava receives from the upper half of the body, while inferior vena cava receives blood from the lower half of the body, and they all come into the right atrium. Now here in right, this inferior vena cava and superior vena cava are not guarded by any walls, so there is the blood can flow back also in the inferior vena cava, superior vena cava. So opening will doesn't have any walls, and from right atrium, blood goes to the right ventricle through the wall, where it is only always one-way direction. That wall is called tricuspid wall. So when blood flows from the atrium to the ventricle, this tricuspid wall open. But whenever blood want to flow back from the ventricle to the atrium, this tricuspid wall closed. It always maintain the one-way direction of the blood flow. Apart from this, right atrium also got a two important structure, that is sinoatrial node, also called as AC node, which is a pacemaker of the heart. Whatever अभी आपका heart rate जो 70-80 के rate पे beat कर रहा है, it is because of this AC node, and it also has a atrioventricular node at the base of the right atrium, where the just junction of the ventricle and atrium, and also band which join AC node to the right node, that is AV bundle, that is also will be there in right atrium. Then come to the left atrium. Left atrium receives the blood from the lungs through the pulmonary veins. And there are four pulmonary veins which present in the left atrium, to come from the right lungs and to come from the left lungs. And they directly pour into the left atrium. Left atrium also very thin wall. From blood from the left atrium will goes to the left ventricle, and that will be guarded by the bicuspid wall, or also called as a mitral wall. So this wall is a tricuspid wall. This wall is bicuspid or mitral wall, and this also make it a one way. So blood will always move from the atria to the ventricle. Whenever blood want to go back from the ventricle to the atria, this wall will close. Remember this, the directions of the wall, and because of this wall only, that unidirectional flow is maintained. Now come to the structure of ventricle. Ventricle is much thick wall, but if you see the difference, left ventricle is much thicker. If you see this, left ventricle is much thicker as compared to right ventricle. Why? Because left ventricle pump the blood to the systemic circulation, which is a high pressure circulation. So normal pressure is somewhere around 80 to 120 mmHg in the cardiac cycle, and that to overcome that much pressure, it has to generate pressure more than this, more than 80 mmHg. And for that, the walls will be develop more muscular, and that's why they are more thicker as compared to right ventricle. While right ventricle has to pump the blood into pulmonary circulation, which is a low pressure. It is somewhere around 10 to 25 mmHg. So they have to generate hardly 10 mm or 12 mm, more than 10 mm pressure to pump the blood into the uh, lungs, and that's why there's as they need to generate low pressure, less muscles are required, and that's why they are a very thin walled structure. And once the blood moves from the left ventricle to the aorta, it goes to the aorta through the wall, and that wall is called semilunar wall or aortic wall, and it is also one-way direction. So it allows only blood flow from the ventricle to the aorta. Backflow will not allowed. Similarly, right ventricle is also guarded. Pulmonary trunk is guarded by the semilunar wall, and that is also called pulmonary wall also. And here also blood will move from the right ventricle to the pulmonary artery or pulmonary trunk. But whenever it want to flow back, the walls will be closed. So this is how whole things will work, and it will maintain the blood flow. Now, if you realize, the blood is moving from coming from the rest of the body into the right atrium. Then from right atrium, it goes to the right ventricle. Now, right ventricle increase the pressure. As you know the law of pressure, blood will always move from high pressure to low pressure. So as the pressure increase in a chamber, blood will try to move away from the chamber from high pressure, and it will try to go to the right atrium, but that will close this wall, as this wall will not allow black flow. So this wall get closed. So there's only way to move out is it will move through the pulmonary trunk, and then through the pulmonary artery it goes to the right and left lungs. Then blood will start moving in the right and left lung, get oxygenated, and then it will come through the pulmonary veins into the left atrium. From left atrium, blood will move to the left ventricle when ventricle is relaxing. And now when ventricle start contracting, it will increase pressure, and that will close this wall, and blood will now from here it will move into the aorta. And then from aorta it goes to the rest of the body. This is how the blood will move into the lungs. Remember this. Next class we need to talk more detail about this. Now to come to structure of the wall, there are four walls which are present in the heart, and these are, one is bicuspid wall, or also called as mitral wall, tricuspid wall, semilunar wall. The semilunar wall has a cups like a, they look like a half moon structure. That's why their name is given semilunar wall. And the cups, mitral wall has only two cups. That's why it is called bicuspid wall. And tricuspid wall has a three cups. That's why it is called tricuspid walls. Uh, as the mitral wall has to withstand with a very high pressure, whenever heart contract, it increases the pressure up to 80 to 120 mmHg high. So there is a probability that it might open in opposite direction. So to prevent that opening up in opposite direction, they are guarded by the tendon-like structure. These are called chordae tendineae. So here these muscles, these walls are usually guarded by the tendon-like structure called chordae tendineae, and this chordae tendineae attached to the muscular extension of the left ventricle. This you will see only in the left ventricle, and these are nothing but the papillary muscles. This is cord-like structure, chordae tendineae, and the papillary-like structure will guard the edges of the bicuspid wall. It doesn't allow bicuspid wall in open in opposite direction. Then come to the semilunar walls. These are two walls, aortic walls and pulmonary walls. The structures, they look like a more of a semicircular canal. You can say anterior, posterior, and all those things will be there. And they always allow the one-way opening. So it always allow blood flow from the ventricle to the arteries. But whenever it want to flow back, these walls will close, and it will not allow the backflow of the blood. And that is the major function of these valves. Okay, now come to this structure of the heart, where coverings of the heart. So when you see the heart is nothing but it is made up of muscles. That is cardiac muscle. But this cardiac muscle is covered with the two coverings. One is outer covering, that is called pericardium. Inner muscular structure is called myocardium, while there will thin inner covering that is called endocardium. Pericardium is one of the fibrous sac which completely enclose the myocardium or heart, and it almost goes up to the right ventricle and also covers almost left ventricle and left atrium. Major function of this pericardium, it lubricate the movement of the heart, and the heart is continuously keep on functioning. There is continuously contraction and relaxation is going on, and there is a fluid is present between this pericardium, which contain two layers, serous layer and fibrous layer. In those layers, there is a fluid will be present, and that will lubricate the movement of the heart and doesn't allow to cause damage to the heart. That is one of the major function of the pericardium. That fluid is contained is somewhere around 5 to 30 ml, and and another function is it doesn't allow the overstretching of over inflation of the heart. So it prevents the over inflation of the heart also, and it protects also heart from the any external injury. Then come to the myocardium, which is actually a cardiac muscle, and they had a different structure like muscles which made up of the walls of the atria and ventricles, and they also autonomic. They generate their own rhythm and contact on their own. They are not dependent on the central nervous system to keep on sending stimulation. So, but central nervous system can increase or decrease the heart rate, and they are the one part of the cardiovascular system which generate the force into the cardiovascular system and maintain the blood flow. Then come to the endocardium. It is thin endothelial layer, smooth endothelial layer which present on myocardium internally. It is very thin layer, and this is like endothelium is similar like that of the endothelium of the blood vessels. And their major function is it doesn't allow blood to clot. So because of their smooth nature, it doesn't allow blood to clot and to prevent the damage to the blood, because the blood will stand with a very high pressure and which can cause injuries to the blood. So because of the smooth nature of this endothelium, it prevent the injury to the blood and prevent the coagulation and all those things of the blood. So that is, and also provide nutrition to the myocardium. So this endocardium will also provide the just myocardium which close to the endocardium. Those myocardium it provide also nutrition. Then come to the cardiac muscle. Okay, before going for this cardiac muscle, we'll take a 5 minutes break and then we'll continue. Okay, so now we see the structure of cardiac muscle. Um, the cardiac muscle is similar like that of the skeletal muscle, that it has striations. So that is there is regular arrangement of the actin and myosin filament. But the only problem is that cardiac muscle is more of skeletal muscle is more of cylindrical nature, while cardiac muscle is more of flat nature. Now it is not like a cardiac skeletal muscle. You take a cross section, it is more of like this, look like this, and there will be nucleus. While cardiac muscles are more of flattened ribbon-like structure. Another difference is the cardiac muscle is branched, and they communicate with each other, not with this along the fibers, but also in each other fibers. That's why they are technically all these muscles are function as a one complete unit. While in skeletal muscle, these muscle fibers are not interlinked with each other. These separate muscle fibers will be separate, and that's why they had a different activity. Well, here the one's action potential occur in one muscle, it will spread in all muscles of the uh, heart, and that's why they work as a complete one unit, or also called as sensation. Then there is an intercalated disc between the two muscle fibers, and this intercalated disc has a perforation, and there can fluid can easily move, or electrode can easily move through this intercalated disc, and it is like a tight junction between the muscle fibers uh, that doesn't allow the movement of the much ions. Okay. Okay, so this is another function, and the nucleus are usually present in the central portion, not like that of the skeletal muscle, where the nucleus are usually pushed in periphery. Then this interconnected this also provides a strong bond between the two muscle fibers, and that doesn't allow them to separate. So whenever this contract, these muscle fibers will generate the force, and it will provide a tensile strength to the whole muscle, so that there will be they will muscle will come towards the center of the heart, and it will contract, and that will generate or increase the pressure inside the muscles. While two adjacent fibers, they are connected through these gap junctions, this branching, and that's why action potential can pass through from one muscle fiber to the other muscle fiber through these very low resistance branches. And that's why cardiac muscle act as also as a syncytium, or one single unit. Then in cardiac muscle, the syncytium are two types. The one atrial syncytium, so atria act as a one single unit, and one ventricle syncytium, that ventricle act as a one single unit, because atria and ventricle are separated by the fiber rings, through which on this fiber ring these cardiac muscles are inserted. That usually goes along with the walls. Then come to the action potential generation in the cardiac muscle. So action potential generated in the cardiac muscle is very, very different as compared to action potential generated in the nerve, or action potential generated in a skeletal muscle. So here resting memory potential is similar like that of the skeletal muscle, which is somewhere around minus 85 to minus 95 millivolt. On an average, it is minus 90 millivolt. Firing level is also somewhere minus 65 millivolt is a firing level. And there is a different phases. So the phases are divided into numbers: zero phase, phase 1, phase 2, phase 3, and phase 4. Where zero phase is a phase of rapid depolarization that is normally occur with a any other action potential, like neuron muscle or skeletal muscle, but rapid opening of the voltage gated sodium channel. There is rapid entry of the sodium ions, and this rapid upstroke, and the action potential can goes up to plus 20 to plus 30. Okay, that will be the rapid deviation. It is usually because of opening of voltage gated sodium channels. But once the potential reaches up to minus 30, minus 40 millivolt, there is also contributed by the another channels, and these are voltage gated calcium channels that also contribute, and that will cause increase in membrane potential. Once this it reaches to the peak, then it will suddenly will start falling. So this is zero phase where the depolarization occur, and once it reaches to the peak, from there it start falling. Then that will start the phase one, and phase one is for very short duration, and there will be rapid fall in the membrane potential that will come somewhere around from plus 30 to it start going to towards around 0 or up to minus 10, and it is because of the rapid inactivation of the sodium channel and closure of the smallest channel, and opening of the slow voltage gated channel. These are also called as a transient outward current, or it is also called as rectifying potassium channels. So they are slow to open, so they slowly they will start opening. So there is an entry of the potassium ion, exit of the potassium ion will be there, while and sodium will entry of the sodium will be stopped. And that will cause rapid repolarization phase. Now, what will happen as the calcium channels are still open? As we see, calcium channels open by minus 30 to minus 40, so they are still open. Sodium channel completely closed, and potassium channels start opening. So now there will be what happen? Calcium will start keep on it coming inside the cell, while potassium will keep on going, and that will balance, and it will make one very stationary membrane potential that will remain from minus 20, sorry, minus 10, and it can go slowly. It can goes up to minus 20 or sometimes minus 30, and it will last up to minus 40. Once that plateau phase will be this up to minus 40. So this is a plateau phase, and it will make the depolarization phase. That is a cell will still towards the zero or towards or close to zero. So it is a cell is a still in a depolarization phase, and that plateau phase will maintain the depolarization state of the cell membrane for up to 100 to 20 millisecond. जो एक्शन पोटेंशियल skeletal muscle में cardiac muscle में hardly stay for few millisecond, it goes up to 100 to 20 millisecond, and because of this it causes a cardiac muscle contraction for longer time. That is around 5 to 15 times longer as compared to skeletal muscle. And that the both thing is because of opening of this L type of the calcium channels, which there is a slow influx of the calcium is going on. At the same time, there is a closure of these potassium channels, which allows the outflow uh, outflow of the channel that will be sorry, inward movement of the potassium channel will be that will be closed, so that will maintain this slow phase. So that slowly potassium is moving inside, well, sorry, moving outside, and calcium will moving inside, and that will maintain the plateau phase for the longer duration. And because of the long duration of the plateau phase, cardiac muscle can contract for the longer time. Then the third phase is a phase of repolarization. And it will cause complete repolarization, and this also lasts for somewhere around 50 milliseconds, and it is because of the started closing of the calcium L type of the calcium channels, and also it opens the delayed outward rectifying potassium channels. So there is a early rectifying potassium channels, now here delayed rectifying potassium channel, and which allows the exit of the potassium ion from the cell, and that will start decreasing the membrane potential. And also whatever the extra calcium is present inside there, that will also elevate the sarcolemma calcium level, and that provide the additional calcium for the muscle contraction. Then come to the fourth phase, that is resting membrane potential, which is somewhere around minus 85 to 95 millivolt, and it occurs because of restoration of the sodium potassium ATPase, and also through the inward rectifying potassium channel and other potassium currents that will contribute and forms resting membrane potential. This is one of the important part of the cardiac muscle physiology, the action potential and the plateau phase. Now, what is the advantage of this plateau phase? Okay, आप properties चलोगे. Okay, what is the advantage of this plateau phase? Plateau phase will give the long duration of action potential to the cardiac muscle, and that allows heart to contract for longer duration. Now, skeletal muscle will contract and relax, but we want heart to generate the pressure. So long duration will help the heart to contract slowly and generate the pressure. So to generate the pressure, we need long duration of the contraction, and because of this long action potential, that able to possible. Second thing, it increases the refractory period of the cardiac muscle. So because of long plateau period, the cardiac muscle will become having long refractory period. So if you voluntarily stimulate the cardiac muscle, but that impulse, that cardiac muscle are still long refractory period up to phase 2. So because of the long refractory period, they will not respond in phase 0, phase 1 and phase 2. And so they will not able to tetanize. So because to function the cardiac, we want there should be contraction followed by relaxation. Contract होता रहेगा, so it will not generate pressure. So there is always contraction followed by the relaxation. So it will give enough time for cardiac muscle to relax. So it will not allow the cardiac muscle to tetanize. That is another advantage of having long plateau period. Another advantage, since cardiac muscle cannot be tetanized, cardiac muscles cannot get fatigue. So cardiac muscle become unfatigable. अब सोचो आपका हार्ट कभी काम करते थक जाए बंद कर दे, तो हमेशा के लिए आप बंद हो जाओगे. So that doesn't happen because of unfatigability of the cardiac muscle. That's why we can our heart still start working before your birth and continue still your last breath because of unfatigability of the cardiac muscle. So that will use enough time of the cardiac muscle to recover also, and it doesn't allow it to get fatigue. So these are few advantages of the plateau phase. This is all about the today's class. Next class we'll talk about the properties of cardiac muscles, and then we'll start cardiac cycle. Okay. Thank you. Have a nice day.
Thank you, sir.
Thank you, sir.
Bye.
Thank you, sir. Thank you,
Sir,
sir.
please, can you share the PPT?
Yeah, yeah.